but they all do the same thing, all of these systems. And what they do is they're lasers that don't they don't affect the surface of the skin, so they penetrate under the skin and remodel the collagen. The other lasers, they're resurfacing, you're actually ablating, you're actually removing the surface of the skin, so you have a wound and it's going to take you about a week to heal. With these, you just have a little redness because the laser penetrates the surface and just goes under the surface of the skin and remodels the collagen, kind of builds up the collagen a bit, and what it does is, without causing damage, the body can be tricked into producing new collagen in response to the perceived injury. So there's improvement in appearance of wrinkles without wounding the surface of the skin. So I mean, this sounds almost magical. The truth is, it's not that dramatic. And there are some studies that this is what they does, you know, it inflammates, and these are some of the patients before and after, and you can see some improvement in the periocular wrinkles, and this was one of my patients before and after. So this is really new. The studies are very, very small, and there's some encouraging results. I think we're going to see a lot more of these lasers developing, these lasers that won't wound the skin, where you can actually plump the collagen and have some satisfaction. Now, what we are doing is we're combining them with microdermabrasion and with Botox. And one of my patients brought this article to me. I guess you all saw it in the newspaper. And given that we are in Botox Raton, let me briefly talk about what are we doing with Botox. And Botox is probably the best thing because it's very, very safe. There's hardly any side effect. The only side effect is that very, very low risk that if the medicine somehow gets in a vessel and goes down into the eyelid, you can have a little bit of a droopy eyebrow for a week or two. It doesn't necessarily have to last the whole amount of time. But aside from that, there's no allergies. There's very, very little risk. And these are the areas that are treated, mostly the frown, the forehead, and around the eyes. And you can have like a little bit of a brow lift. You can actually raise the eyebrows with Botox. You can also treat the lower eyelid, and I'll show you some pictures to make the eye look bigger. And less commonly treated areas, we're treating the lips, the marionette lines. There's also people treating the neck with it. There's about 100 uses of Botox now. The more that we use it, the more uses that we discover. And there's two types of Botox. One of them is type A, which is the one that you hear about, which is the Allergan. And MyoBlock is another type, which is type B, and it's licensed in the United States as well. The difference is it's good for people that don't respond to Botox, but it doesn't last as long. And Botox lasts about 4 to 6 months. In the forehead, if you don't have real strong muscles, you can stretch it for maybe 9 to 11 months. So it's something that you might think to do maybe once a year. And as you can see, this is a patient before and after Botox, and it really is miraculous. This is one of my patients, and as you can see, pre-procedure. And also notice when she smiles, that's not smiling and this is smiling. And notice the wrinkles around her eyes. We did her frown, we did her forehead, and we did around her eyes. And look at the elevation of the eyebrows. That's something that you can accomplish with Botox, which is really great. It elevates the eyebrows. And also look at the eyes. See how much bigger they look, because the wrinkles under the eyes kind of go away as well. So it's very safe, very effective. So what else can we do? We've looked at skincare programs, we've looked at chemical peels, lasers, non-abrasive lasers, Botox. What else do we do that's really non-surgical? Fillers. And what fillers are, that's why we call them fillers, because they actually fill an area where there's substance missing. And you really, when you look at somebody, you want to see what's missing, how much they need, because you need to estimate how much volume or how much of this compound are they going to need, for example, for nasolabial folds or for deep furrows. And this is the list. There's tons and tons of them. In the United States, the most common one is collagen. And this is what it does. This is if we take a chunk of the skin, and we inject the substance, if it's Cyderm 1 or if it's Cyplast, different type of compounds. Some of them are thicker than others, and that's why some of them last longer. And these are the areas that we can treat with collagen, common areas, the horizontal forehead, the glabellar lines, the vermilion border. That's very, very popular, and I know you've seen a lot of those movie stars that little exaggerated and their lips are out to here.